All right, looks like we're live. So right now, I'm John from First UCC, and that is my friend Dr. Mike. That's a
Good day.
that's an improper salute, but I'll forgive it, bud. Um, okay, so we're doing a medical chat with you, and just kind of getting your perspective of this as a medical doctor, and hearing your general scope of things for COVID-19. Coronavirus, whatever anybody calls it, and just hearing what you'd recommend and your general ideas. So, before we get into anything, is there anything that you'd like to say?
Well, thanks for doing this. I mean, this is great. I think this is a good way to get information out. I mean, just for the record, today's Thursday, March 26th. And the only reason that I say that is because things change and things change by the day and by the hour during this pandemic. So I just wanted to make sure that, our information is current for the day. And I hope to answer as many questions as I can and dispel as many myths. And I know that you have a list of questions that were kind of prepared that may be on people's minds. And I think kind of the best way we can do this is just kind of roll through those questions.
Yeah. Okay. All right. So the first question is, and I've heard this one a lot, isn't COVID-19 just the flu? What's the big deal?
Yeah, well, and that's out there quite a bit. And unfortunately, it's not. I mean, there are
Yeah.
things that are very common with the flu. The symptoms, for example, are very common. High fever, greater than 100.4, dry cough, shortness of breath. They're all, those are symptoms of COVID, but certainly could be symptoms of the flu.
Yeah.
Unfortunately, COVID, there's no treatment and there's no vaccine. So for the flu, we do have medications that we can actually treat influenza, Tamiflu being one of them, and people get vaccinated. So that's one of the biggest differences. With COVID, there is currently no treatment per se, and the care is what they call supportive. We just make sure you're able to breathe and those kind of things. So that's one potential difference.
Hmm.
The other differences are that the COVID virus is now out there and is much more infectious between people than influenza. So that they call it an R number that basically means that when you have the flu, you can infect 1.3 others, and COVID is actually about 2.5. So it's
Oh.
much more highly infectious.
Yeah.
That's number one. Number two, you're much more likely to get sick from COVID. The people who require hospitalizations for influenza are actually very small, important, but small. You're much more likely, like 10 times more, 20 times more likely to be hospitalized with COVID. Unfortunately, COVID is also more fatal. And again, the fatalities are small compared to the number that are actually infected, but your chances of dying are about 10 times more from COVID-19 than from influenza. So this is
That's
this is pretty
significant.
serious business.
That's significant because one of the responses from those who say that it's just a flu is, "Oh, we have so many people dying every year by flu, but nobody makes a big deal." But what's
Well, and
important to
that's
remember,
that's really true, John, because
hmm
unfortunately, influenza kills
yeah,
about 10,000 to 60,000 Americans every single year.
mm,
And in fact, this year we had a rise in pediatric deaths, which is several hundred in the U.S.
yeah,
Children have died. We kind of live with that because that's an every year thing. But if we really practice good hand washing techniques, et cetera, we can make a difference in flu as well. Unfortunately, the numbers for this initial COVID outbreak could be much, much higher than the influenza numbers for any given year. There's also no guarantee this is going to go away. This could become seasonal.
gotcha. Okay. I've also heard from some that they believe that this is just kind of a virus just for older people. It's just a virus for those who have immune system problems. What's your response on that?
Well, that is one of the biggest myths out there,
Yeah,
and
yeah,
I think in part that people in the medical community, including me, have been responsible for perpetuating a part of that myth. The truth is that the highest risk groups are those over 65. So those people are at highest risk for getting seriously ill or for dying from this virus. The fact is that this is serious. That almost half of the hospitalized cases right now in New York are under 65, and in fact range from pediatric patients all the way through, senior citizens. So this is definitely not just at risk to the elderly. A number of deaths have been in the 20, 30, 40, 50 age group as well. And these are otherwise healthy people. This is a serious virus that can cause a very bad pneumonia and something called ARDS, or adult respiratory distress syndrome, which is a very serious and critical illness.
Gotcha. Okay, so it seems like, though initially people were saying, oh, this might be just the older people or people with, kind of this, at-risk individuals, that really anybody can get it. And we keep seeing cases pop up around the world and around the nation with people of all different ages and people of all different demographics. So it really should be taken seriously. Looking down at this list of questions, let's see, here's one that I thought was good. If a doctor said I should be tested, but I can't find an open test center, what should I do?
I think that's an excellent question, and that comes up on almost a daily basis now. So let me back up to just say that if you are sick and you're feeling ill, don't panic, okay? The first thing that you should do is obviously call your primary doctor or your primary provider, because regardless of what I say, what you hear on television or in the media, it's going to be that doctor, that care center that has your records, that knows you best, that's going to be able to help you and triage you to receive the best possible care. I mean, none of us wants to get COVID, but the bottom line is we should use common sense. We shouldn't dial 911 just because we have a fever. We wouldn't do that normally.
Yeah.
We would just kind of sit around and take Tylenol and watch TV and eat chicken soup, and that's still great. That still works, and do that. So you phoned your doctor, and the doctor says, okay, I think you should be tested. The doctor's going to have the most up-to-date information on testing centers locally. Testing centers are available. They are at times open. Sometimes they are forced to close for a number of reasons. They run out of test kits. The weather is poor, whatever the situation may be. The doctor's office is going to have the most up-to-date information, and we actually have ways of exchanging that information now very quickly in the medical community. So testing really doesn't matter immediately, and I don't want to downplay testing, because testing is important, but it's not going to change how you're treated. So if I would tell you, Pastor John, that I felt that you needed to be tested today, it's not going to change how I care for you, because there is no specific treatment. Obviously, we would like to know cases in the county and where the virus is and so forth and so on. But there is really no urgency to testing someone who's ill, because we're going to treat you and triage you the same exact way, whether you're COVID-19 positive or not. So I would not panic over not being able to get tested on any specific day.
Well, that's a really good perspective. And so on that line, if somebody just feels sick in general, or, anything like that, and maybe they can't test it, or maybe they can't pinpoint it, just go off of what Governor Wolf had suggested. Just assume that you are infected,
Correct,
and act that way, right?
And the guidelines for low risk individuals, again, we talked about that: fever 100.4, dry cough, shortness of breath. Now for seniors, it's a little different. Over 65, they're now recommending that if you have a fever greater than 99.6, 99.7, that you phone your doctor. And the reason is that that body temperatures in senior citizens are not as point accurate as they are in a younger population.
Right. Okay. So I just wanted to ask a few questions that people just have about their everyday life. So we're dealing with issues of, okay, I'm homebound, but I still got to go to the grocery store. I still have to, maybe I need food and maybe I don't have what I need. Maybe I'll think about ordering takeout. Maybe, all my family's getting antsy. We're all in the house together. It's getting nuts. Can I just go for a walk? Is that all right? I just kind of, and another thing is, oh my goodness, all the hand sanitizer is out. What am I supposed to do? All right, so just kind of those practical things of what do you do when hand sanitizer's out? Is it safe to go outside? Is it safe to get takeout food? And if so, what do you do? And what do you do when you need stuff from the grocery store?
Sure. I think there's a lot of there's certainly a lot of questions there and a lot of good information. So I'm going to start with, we're all kind of hanging out at home, and that's a social isolation, if you will. I don't even like that term because we're not socially isolated right now. We're talking and looking at each other. So we're physical distancing is what we're doing,
yes.
Really. And I have a little slide that I think I shared with you, John, about the importance of physical distancing. And a lot of the stores, a lot of the supermarkets and pharmacies are practicing this with lines on the floor to keep people apart. And it's important. It is important for the spread of the virus, and it's also important for your safety to keep away from other people. Now, it's kind of a busy slide, but the power of social distancing. So if you just do nothing, okay, the top line now, one person infects 2.5 people. I talked about that R number that we talked about. And over 30 days, we project that you potentially could infect 406 people.
Yeah.
So let's cut that number in half. Let's take the R number in half and say that we do 50% less exposure, that we come in contact with 50% less people, half. In 30 days, look at that number. It's cut to 15 infected. And again, in the bottom thing, if we have 75% less exposure, one person infects only 2.5 people. So I think that's the real take-home message, that you can go out, but practice social distancing. Stay away from other people. Follow the instructions in the stores. Many people are getting one. The other thing, I have another slide that I shared with you about hands and hand washing. Mm-hmm. And hand washing, we're tired of hearing it. I mean, our mothers and grandmothers and grandfathers all told us, wash your hands, do this, do that. This slide actually is really powerful because in the upper left-hand corner, you can see they use this kind of fake dirt, if you will, and before washing, the hand lights up. So, if you're kind of in a rush like most of us are, that second is the rinse and shake, where you just kind of run your hands underwater. Not very effective. The 6 seconds underwater, which actually is a fairly long time if you count it out, also not real good. So then we go down to number 4 in the lower left-hand corner, 6 seconds with soap and water, and then 15 seconds with soap and water, and then 30 seconds with soap on the far right. We have clean hands. By the best information we have available, hand washing by using 30 seconds, 20 to 30 seconds with soap and warm water can reduce the spread by 30 to 50%. And that's dramatic.
Yeah.
And so, I think we really need to rethink our hand washing, that it's not just, okay, Mom, I'll wash my hands before dinner, but this really is going to make a big impact in preventing the spread and preventing any individual from getting that virus.
Yeah.
Now, when we talk about seniors going out shopping, a lot of the supermarkets, some have instituted where you can call in your order and they'll have it ready for you to pick up and no contact trade-off. I know some of the local supermarkets here in the Quakertown region have instituted a seniors only hour. They disinfect overnight, and they have an hour in the mornings that they only allow senior citizens to shop during that time. All good things. The other thing is pair up, do teamwork, call your friends. If you have to go out, call your friends. Do you need me to pick up anything at the pharmacy while I'm there? Do you need anything food-wise? Pick in groups of 5 or 10, fewer people on the roads, fewer people out and about. Everybody can contribute. And as well, it doesn't just have to be for seniors. Young people can call. People have called me. I've called people. Do you need anything? I'm on my way out. So that's really, really important to kind of come together and help each other while we prevent the virus. Now, you mentioned hand sanitizer. Hand sanitizer is not a substitution for washing hands. And some people think it's better. It's not.
Right.
It is not as good. So if you have the ability to use soap and water, you're really good with hand sanitizer. Now, hand sanitizer is necessary if you're in a car, you don't have access to soap and water. The good news is there is a local distillery in the area that is now producing hand sanitizer 24/7. They have no contact pickups. You can call them and make those arrangements. So there is now hand sanitizer available in our area.
Is that Faber?
Correct.
Okay.
And they have switched their production. So that is available and getting out. But I don't want to, if you are home by yourself, you frankly don't need hand sanitizer.
Yeah. Yeah. It's just nice for those, moments, So you had one other slide for social distancing, especially with the health system capacity, and I wanted you to go over that as well. So let me just switch back to that screen. Okay.
Yeah, so we hear this flatten the curve, and what does all that mean? And it's been a long time since we've been sitting in class and had to interpret graphs. But if we just look at this graph, on the left hand side, it's number of cases. Okay, so whether it's anything, but in this case it's COVID, the number of people that are infected or that are sick. And on the bottom is just time. So time since the first case ad infinitum. Unfortunately, we can't plug in numbers to either of those yet because we don't know how many cases we have.
Right.
In Pennsylvania, approximately 18,000 people have been resulted for testing. Now, that doesn't mean that we've only tested that many. That means we only have results for them. Results take a week. So somebody being tested today won't get results for 7 days. So as of noon today, we had 16,000 results, about 1,600 infected people in Pennsylvania, and unfortunately about 16 deaths. Bucks County, surprisingly, is the 5th county in the state now for number of cases. We haven't had any deaths, thank goodness.
Yeah.
But we are number 5.
Wow.
So we don't have that number of cases yet. Time, since our first case, we're chugging along. So without protective measures, what's going to happen is a lot of people are going to get infected very quickly. And while most cases are going to be mild, some are going to require hospitalization. And that's going to provide a huge spike that's going to overwhelm the hospitals. We're seeing that now in places like New York City. By using distancing measures, by using hand washing, social distancing and hand washing, and what they're recommending, we're going to use that blue area of the curve. While we seem to prolong the time that the virus is kind of out in the community and think, well, why would you want to do that? Well, the reason is to keep below that healthcare system capacity line. So even though it may take a little bit longer to get through this, we are not going to overwhelm our healthcare system, and that's important. Once the hospitals are full, once the ventilators are out, we're looking at putting hospital beds in schools, in convention centers, creating mock hospitals and sometimes in tents. And obviously the care is not going to be as good if that happens. So we want to avoid that at all costs. So that really is the what the flatten that curve means. Help the community stay protected, and let's not overwhelm our resources.
Yeah. Well, thank you so much. I think that what we have as far as questions, a lot of the questions you've answered through just talking through it. There has been one other thing that I've heard, and that's, people have been saying, and you kind of mentioned that it might be seasonal going forward, but people have mentioned, just like the flu, it happens at a certain season. Will COVID-19 just disappear as far as its infecting power when the warmer months start coming in?
We have no idea, to be
Yeah.
honest. There's a lot out there in the media. There's a lot of suggestion. Dr. Anthony Fauci, who you may have heard in the media, he's a very bright man, and I would certainly listen to him, suggests that it may be seasonal. We have no evidence to say that this is going to come back next year. We also have no evidence that the warm weather is going to help us, that this is going to disappear like influenza.
Right.
What I can tell you, John, and it's unfortunate, is this isn't going away anytime soon. We have not even peaked in this state or the country with the number of infected people, even if everybody isolates right now. We have a lot of unidentified people out there that are infected that don't know it. You can carry this virus for up to 2 weeks, feel perfectly healthy, and be infected. That's why you and I are not meeting in person today, because you don't know if I have it, and I don't know if you have it.
Right.
So unfortunately, we're not even going to see the worst of this until into April. Now, I don't have a crystal ball, but many experts are now predicting we're not going to see the worst infection rates, the worst case scenario, until in April now.
Oh, wow. Okay.
So all of this stuff is still fresh and still relevant. Just because you've been doing it for 2 weeks doesn't mean, Saturday's the day to go have fun. That everybody's efforts are going to be vitally important to this mission.
Gotcha. Well, is there anything on top of what you've already covered that you wanted to go into? Most of the stuff that you've covered just talking about it. One of the things that was the last question, which is it's about bottled water versus tap water for COVID-19.
Sure, and I think that's a great question. Now, I know a lot of people don't like tap water for whatever reason. The Deer Parks and the bottled water community makes a lot of money, and I can tell you from a public health perspective, and I'm not dissing any product or anybody in particular, but the tap water in our regions are monitored much more closely than any bottled water product ever will be. COVID has not been shown to be transmitted through water, nor has it been shown to be transmitted through things like takeout food, which you had mentioned before. The no human contact is a great idea. So takeout food is safe. We have no cases documented of somebody catching it from a pizza. So we don't have to worry about that. Tap water is safe. It is not going to transmit the virus. You do not need bottled water, and some people prefer it. But from a public health perspective, I will stick with tap water.
Good. All right. Well, I think that's it for now as far as the questions and kind of getting your medical perspective. Do you have any notes of encouragement? Anything? Just final words kind of thing?
Sure. Again, be good to each other. And that's what a church community can do for each other. Talk to each other, pool resources, go shopping for each other, see if anybody needs, and, just frankly, just call them on the phone. I haven't talked to John in a while. I'm going to pick up the phone and call him. Encourage each other. I think that's part of what a community is all about. And I think that's going to help all of us in the long run, not only with our church, but in the outside community. Stay safe, stay vigilant, listen to the public health officials, listen to what the governor says, listen to what the local restrictions are. And I think that if we all stay safe and use common sense and follow the recommendations, we're all going to be better off. And, hopefully, if we need to get together in a week or 2 weeks and, reevaluate some of what we talked about today, well, we can do that.
Right. Well, good. Well, I thank you for being willing to do this and kind of having this idea of just, discussing with medical doctor, answering our questions. And I hope that this is beneficial to you all, whoever may be watching. Remember, this is not a time to fear. This is not a time to be really anxious about everything. This is a time to be smart about what you are doing, to follow the advice of the experts, and to still, in whatever capacity that you can, share hope and love to those around you. Even if it's just a smile walking past somebody in the grocery store. They may not have seen their normal people for so long, and just that smile could mean a lot to them. So I would encourage you all to do that. And Dr. Mike, thank you again. And
Thank
I'm
you.
going to end this recording now. And